Most people who have an upper respiratory infection use over-the-counter cold and flu medications to treat their symptoms. But most people have no idea what exactly is in those medications. That's a problem. Most over-the-counter remedies include medications that don't work and medications that you might not need. Now, I'm a physician. I have nothing against using medications to feel better, but nobody needs to take pills that they don't need. If you're like me and have a chronic condition, you already take a bunch of medications every day, and you may be sensitive to side effects. Taking medications that you don't need or don't know can cause more harm than good. That's why today we're going to review common, powerful, over-the-counter cold and flu remedies that you can use to effectively treat the symptoms you have and get better fast. By the end of this, you're going to be able to read medication labels the same way a doctor does, whether you have the common cold, the flu, or even COVID. Welcome or welcome back. I'm Dr. Zeest Khan. I'm a licensed physician with long COVID. In 2020, I was taking care of patients on the front line of the pandemic, and my health took a devastating nosedive. I had long COVID, and I was so ill that I was bedbound for a year. It has completely changed my life, and I've learned so much about this condition and other chronic, complex health conditions that our medical system just doesn't have answers for. We don't have a cure for long COVID, but I got better by harnessing the medical science and the healthcare system that we do have. It's quite powerful, and I'm here to help you understand how I did it and hopefully do the same. You can check out my other episodes, podcasts, and articles at longcovidmd.com. Next, a disclaimer. The following information is for educational purposes only and does not replace personalized medical advice from a licensed professional. This episode references mild to moderate upper respiratory infections in adults that can be safely treated at home. Please seek urgent care for severe symptoms. Check medication side effects and dosing to ensure each is safe for your specific needs. Now let's get started learning about cold meds. I created a slideshow so that those of you who are watching can see the names of the medications I'm teaching you about. If you are listening, I'm going to try to pronounce them very carefully, but you can find all of the names, doses, and instructions in the newsletter that goes with this episode. It's free, and I'll leave a link in the show notes. So I'm calling this presentation Personalized Cold Care. I think it's really important, especially if you have a chronic illness, to match the treatment to your symptoms. If you have a good understanding of what your symptoms are and you know the tools or the treatments available, like which options, you can then pick what is right for you. Like I said, this is a really empowering way to approach your health, even for something as quote unquote simple as a cold, because a lot of us know that we don't bounce back as quick as we'd like to. And a simple cold can turn into weeks or months of worsened overall health. There are 4 categories of medications that are typically in a generic cold and flu medication at the drugstore. I'm going to go through each one of those 4. You're going to end up finding that the cold medicine that you pull off the shelf has any number of combinations of these drugs. The first is a pain reliever or a fever reliever. So it's either going to be acetaminophen, which is the active ingredient in Tylenol, or ibuprofen, which is the active ingredient in Advil. Next, and a really big important category, is a decongestant. A decongestant is the medication that's going to reduce the congestion in your nose and sinuses. That congestion is really important to attack because the more you're congested, the less airway flow you have, and you basically have stagnation. That infection doesn't have the opportunity to clear, and it sets you up for a secondary bacterial infection affecting either your sinuses, your throat, your ears, sometimes even your eyes. To relieve that pressure and open up the airways, decongestants are used. Decongestants are a category of meds called vasoconstrictors. They tighten the blood vessels. The blood vessels in your sinuses are dilated to help get, all those good white blood cells into the area that has the infection. The problem is when those blood vessels are dilated in a tight space, it adds to the stuffiness and can sometimes backfire. So a vasoconstrictor, which is a decongestant, helps clear your airways and allow you to do things like sinus rinses to get that infection cleared out. There are two big categories of decongestants, pseudoephedrine and phenylephrine, and only one of these medications is worth using. That's pseudoephedrine. Pseudoephedrine is the active ingredient in Sudafed. Here in the United States, at least, it is a semi-controlled substance. So you're only going to be able to find this behind the pharmacist's counter, and you're going to need a form of ID before purchasing. This is because Sudafed can be used in making stimulants like methamphetamine. That sounds scary, but pseudoephedrine, when used appropriately, can be a very safe and effective tool. When Sudafed became semi-controlled, that was replaced with phenylephrine. Phenylephrine is also a vasoconstrictor, but it's not a controlled substance. And so it is in the medications that are in the drugstore aisles themselves. Multiple studies show that phenylephrine is not an effective decongestant. So it's not really worth using. And that's because both of these medicines have similar side effects, and only one is effective. So both can change your heart rate and blood pressure. So that's why these medicines are not recommended in people who have high blood pressure already or heart disease. If you have pre-existing dizziness, like those of us with dysautonomia might have, take care when you're using this type of medicine and be careful, changing positions. But Sudafed can be really, really helpful for a short period of time. It's not meant to be used for long term. And that's because the long-term use of pseudoephedrine can chronically change your heart rate and particularly your blood pressure. That can be really difficult to fix. The next category is antihistamines. Antihistamines are included in cold and flu medicine to help treat rhinorrhea. That's a runny nose and the sneezing that goes with it. It also has a tendency to dry up your mucous membranes. That's good for a runny nose, but it can also cause a dry mouth. There are two types of antihistamines broadly, first generation and second generation. The difference between these is that first generation antihistamines cross the blood-brain barrier and have central effects. Those central effects are dizziness, sometimes lightheadedness, and drowsiness, most importantly. So your nighttime cold and flu meds are going to contain a first generation antihistamine. Second generation antihistamines cause less drowsiness, so they're more appropriate for daytime use or if you want to avoid feeling sleepy. We have one more medication to cover, but before I do, I want to encourage you to join the newsletter and the community over at Long COVID MD. There are thousands of us who are navigating long COVID and complex illness together. The newsletter is free. We are in a time where healthcare is getting harder and harder to access. And I am dedicated to sharing what I know about the healthcare systems so that you can be as empowered and educated as you can be before you walk into that doctor's office. To support this effort, you can upgrade to a paid subscription or donate at Buy Me a Coffee. If you can't upgrade, you can help by liking this wherever you're listening or watching, subscribing, leaving a comment. Now let's get back. So the last category of medication is cough medicine. There are two options. Sometimes they are combined, although it doesn't always make sense when they are. Dextromethorphan is a centrally acting medication that controls the cough reflex. And so it's really nice to use for a dry, persistent cough, especially those ones that last for way longer than your cold symptoms last. Dextromethorphan can really help with that. Guaifenesin works in a different way. It is the active ingredient in Mucinex. This drug acts at the lungs to help clear mucus and preferably bring it up so that you can cough it out. And so this is nice for one of those wet coughs or when you feel like your cold is coming down into your chest and you want to clear that mucus out. Having them both combined may or may not be the right option for you. So take care in picking not only your cough medicine, but any of these ingredients. So how do you decide what cold medicine is best for you? I think the best approach is to match the medications to your specific needs. And typically this means either reviewing the medication label in a combined cold and flu medicine or purchasing the ingredients separately and taking each as needed. That way you can titrate the doses of each medication and take the dose that works for you with the most limited side effects. You can also track the effectiveness or benefit of each medication. The goals in cold care, whether that is the common cold, the flu, rhinovirus, parainfluenza, or even COVID, is to reduce upper airway congestion, keep those airways clear, reduce inflammation, and treat pain. Uncontrolled pain can keep you in bed and keep you from moving. I am not a proponent of pushing yourself real hard and pushing through an illness, whether it's long COVID or the cold or a cold. But I do think it's important that you're able to sit up in bed, that you're able to walk to the bathroom on your own, that you're able to wiggle your feet, walk around your house. It helps expand your airways. It helps your GI system. And it keeps you comfortable. So that pain control element, I think, is often overlooked, but really important too. So let's use an example here. I have had a cold recently, and I did this exact exercise. I looked at what my symptoms were, and I treated my cold really aggressively with certain medications. I didn't end up using a generic cold and flu medicine, and I'm going to walk you through why that is. First, let me tell you what my symptoms were. So I had a fever for a pretty short period of time, aches on and off, pretty prominent sinus congestion, and a runny nose. When I got sick, I looked through my medicine cabinet and I found a bottle of Dayquil. I looked at the ingredients and they include acetaminophen, phenylephrine, and dextromethorphan. Acetaminophen is a mid-range dose that I could tolerate. That would be good for my fevers and aches that come and go. Phenylephrine is not an effective treatment for nasal congestion, but that's included there. And dextromethorphan treats cough, which I didn't have. So if I relied on a generic cold medicine, I would be taking medication that didn't work and medication that I didn't need. Here's what I did instead. I took acetaminophen when I needed it. That was when I felt the fever coming on or when I had body aches. I took pseudoephedrine at a higher dose when my symptoms were more severe and a lower dose when my symptoms were less severe. In the daytime, I took a dose of fexofenadine. That's the active ingredient in Allegra. And at night, for a few nights, I took diphenhydramine, which is the active ingredient in Benadryl. That helped me sleep. This way, I was able to take only the medications that I needed, medications that I knew would effectively treat my specific symptoms, and avoid medications that I didn't need at all. This is what I recommend everybody do. Approach your health in a really tailored, personalized way, because one size does not fit all. Every person is different. I know this from professional experience as a physician and personal experience as a patient. No person is the same. No two colds are the same. No two reactions to medications are the same. You know yourself. Tailor your medical care to your specific needs. I encourage you, in addition to using the medicines, to rest, hydrate, nourish yourselves, just like your real or imaginary grandmother would tell you to do. Reduce stress about the future. A lot of us with pre-existing diseases like long COVID really worry that a new infection is going to make us permanently worse, but that's not necessarily true. The best thing you can do is treat your active infection as effectively as possible, get better as quickly as possible, and reducing your stress and being in a relaxed state really helps that. Get cozy and eat really simple food. We stress a lot about the food that we eat. Keep it simple. Things like chicken noodle soup. For us South Asians, we eat khichdi that is composed of, rice and lentils. Both of those meals have simple, easy to digest carbs, simple, easy to digest proteins. So just keep it as simple as that. If all you can eat is a piece of toast, eat a piece of toast. Focus more on the hydration. I'm going to include a link to my oral hydration episode. It is really going to teach you that hydration is a lot more than water, and it's not that difficult. I am staying cozy by watching comfort shows. I'm currently catching up on the new episode or the new season of Great British Bake Off, and I'm rewatching old episodes too. All of this information and more is in the newsletter over at Substack. I'm going to leave all the pertinent links in the notes. Subscribe so you don't miss upcoming episodes. I've got one ready on nasal decongestants, nasal hygiene, and how you can use that as an alternative or a supplement to oral decongestants. And maybe it'll help prevent you from getting sick again. Remember, you've got this. You're going to get better. This is going to pass. Stay patient, stay positive, and take the medications that are right for you. You know what you do when you have a cold and what's your comfort food or comfort show. I really hope you're feeling well in this moment. If not, I hope you feel better in the next. Take good care of yourselves, and bye for now.